Welcome back, everyone, to The Deep Dive. Today, we're taking a look at a topic that's, well, a bit intense. Emergency response to chemical incidents.
Definitely a high-stakes area.
Absolutely. And to guide us through this, we've got, as always, some pretty interesting source material.
Always love seeing what you dig up.
Well, this time, we've got a chapter from a paramedic textbook. Pretty detailed stuff.
So we're getting into the nitty-gritty.
We are. And to add to that, a real-life case study.
Ooh, those are always fascinating. You really get to see the theory put into practice.
Exactly. So let's dive in, shall we?
Let's do it.
The textbook kind of sets the stage with this quote. Post 9/11, the world has become a different environment. Emergency preparedness is the most important element available to paramedics in such situations. Pretty sobering thought, right?
It really is. And while 9/11 obviously brought airport security to the forefront, it also just really heightened awareness about, well, all kinds of potential threats, including chemical attacks.
And that preparedness aspect, it's got to be top of mind for any first responder.
Absolutely crucial.
All right, so let's jump into this case study. It starts off with a student demonstration. Things get a little out of hand. Possible explosion.
Oh, that's never good.
No, it's not. And we end up with a young man, some burns, and he's having real trouble breathing.
So already a pretty serious situation.
Yeah, and it gets even more complicated because they find canisters of chlorine nearby, like chlorine gas.
Chlorine, yeah. Now that's a whole different ballgame. I mean, most people, when they hear chlorine, they think, swimming pools, keeping things clean.
Right, exactly.
But chlorine in its pure gaseous form, that's highly reactive. It can be really dangerous.
So in this case study, they talk about the burns on his hands, first degree, about 5% of his BSA. Now, how do paramedics even figure that out on the fly? What's BSA anyway?
So BSA stands for body surface area. It's essentially a quick way to assess how much of the body is affected by burns, to gauge the severity. And that BSA number, it's crucial for figuring out treatment and spotting potential complications. Out in the field, paramedics use what they call the rule of nines.
The rule of nines.
Yeah, it's a system where they assign percentages to different body parts, and it all adds up to, 99. Like, the head and each arm are 9%, front and back of the torso, each 18%, each leg 18%. There's a modified version for kids because, their proportions are different.
Okay, makes sense. So in our case study, 5% BSA with the burns on his hands. Even though it might seem like a small area, that could really mess with his ability to use them, right?
Absolutely. Hands are, pretty essential.
Understatement of the year.
Okay.
So we've got burns, we've got chlorine gas. What exactly happens when someone breathes that stuff in?
So chlorine gas, it's a powerful irritant. I mean, think about your respiratory system, all those delicate tissues. Chlorine just attacks them, basically. Yeah, so it can cause this burning sensation, coughing, makes it hard to breathe. And how bad it gets really depends on, how much chlorine there was and how long they were breathing it in.
The case study mentions this treatment, nebulized sodium bicarbonate.
Yeah.
They considered it, but it sounds kind of controversial. What's the deal with that?
Yeah, so nebulized sodium bicarbonate, it's basically this fine mist that you inhale, and the idea is to, neutralize the acid effects of the chlorine in the lungs. But it's not a standard treatment. There's some back and forth about how effective it actually is.
I see.
And there are concerns about potential side effects, things like fluid buildup in the lungs, especially if it's not done just right. So, it's a judgment call.
So our paramedics here, they're really in a tough spot, weighing the potential good against the potential bad. What else would they be thinking about when making a decision like that?
Well, you got to remember, they're out there in the field. It's a dynamic environment. Things are changing. They have limited information. They have to consider the patient's condition, what resources they have available, whether they can get them to a hospital quickly. It's all about making the best call with the information they have at that moment.
Really highlights the complexity of this whole world, right?
Yes, every situation is unique.
And speaking of complexity, the textbook mentions that there can be long-term effects from chlorine exposure, too. What are some of those?
Right. So while many people do recover completely, some end up dealing with lingering issues. Like, one condition that can develop is called reactive airways dysfunction syndrome.
Okay, RAD, yes.
Yeah, RAD. And basically, it's a lung disorder that can pop up after breathing in irritants like chlorine gas. It causes symptoms that are, kind of similar to asthma. Wheezing, coughing, shortness of breath, that feeling of tightness in the chest. Imagine having a persistent cough or, feeling like you can't quite catch your breath, even weeks or months after the exposure. That's the reality for some folks who develop RADS.
Man, that's rough. Really makes you think about the bigger picture here.
It definitely does.
We've touched on some of the immediate dangers of chlorine, but um, there's this whole other layer of complexity with the long-term effects.
Yeah, it's not just about the here and now.
Exactly. And I'm really curious to explore that further.
Well, let's do it.
So we were just talking about those long-term effects of chlorine exposure,
Hmm.
and it really makes you think about the bigger picture here.
It does, doesn't it?
And that textbook really emphasizes how 911 was this major turning point for emergency responders.
Mm-hmm.
Like it forced them to think about things in a whole new way.
Oh, absolutely. 911 really brought about this shift in mindset. I mean, first responders now have to consider a much wider range of potential threats, including these chemical attacks. And that's had this ripple effect on everything, from their training to the protocols they follow, even the equipment they use.
So what are some of the biggest changes that have come about?
Well, for one, there's a much heavier emphasis on hazardous materials training now.
Hazmat training.
Yeah.
Yeah,
Paramedics really need to be able to identify like a whole slew of different chemicals, understand their properties and know how to handle them safely. It's like adding this whole new layer of complexity to an already demanding job.
sounds intense.
It is. And then there's the whole issue of on-scene safety.
Right. Because you don't want to become a casualty yourself.
Exactly. They've got to be hyper aware of their surroundings, assess the potential hazards, and take the right precautions.
Like what?
Well, it could be anything from approaching the scene from upwind to making sure they're wearing the correct personal protective equipment.
The PPE.
Yep, that PPE. And speaking of PPE, the textbook mentions that the paramedics in our case study donned level B protection.
Level B, what does that even mean?
So levels of protection, they refer to the different types of gear that paramedics wear based on, what kind of hazards are present. And level B, that provides a high level of respiratory protection, but a little less skin protection.
So, serious stuff.
Definitely.
Okay, so back to our patient in the case study.
Mhm.
They found his pulse was rapid, but his blood pressure seemed normal. What does that tell us?
Well, a rapid pulse, that's a classic sign of distress. It means the body's trying to compensate for something.
Which in this case would be.
The effects of the chlorine gas, right. It's trying to get more oxygen to the tissues and organs that need it.
Makes sense. So what about the blood pressure then?
Blood pressure can be a little trickier. It can be influenced by so many things, like the severity of the exposure, the person's age, any underlying health conditions they might have, even just their emotional state.
So it's not always a clear-cut indicator.
Right, and that's why it's so important to monitor those vital signs continuously in these situations. We need to see how the patient is responding over time, not just get one reading and call it a day.
The textbook also mentions the possibility of long-term effects from chlorine exposure. What are some things people should be aware of, even after that initial incident is over?
Yeah, so even though many people do recover completely, some experience some lingering effects. Like there's this condition called reactive airways dysfunction syndrome, or RAs. Yeah. And essentially, it's a lung condition that can develop after someone inhales irritants like chlorine gas. And it causes symptoms that are, well, they kind of mimic asthma.
Okay, so what kind of symptoms are we talking about?
Things like wheezing, coughing, shortness of breath, that feeling of tightness in the chest. Imagine having a persistent cough or, just feeling like you can't quite catch your breath, even weeks or months after the exposure.
Wow.
That's the reality for some people who develop ARIDS.
That sounds really debilitating. It really makes you realize that these chemical incidents aren't just about the immediate danger, There's this whole other layer of potential long-term consequence.
Exactly.
And it really underscores the importance of, prevention, preparedness, and prompt medical attention.
Couldn't agree more.
Before we move on, I want to touch on something else from the case study. It mentions that the patient was actually participating in this demonstration to earn some extra money.
Oh, wow.
And it just struck me because, it makes you think about the risks people might take without fully understanding the potential consequences.
Yeah, it's a really important point. I mean, we often associate chemical incidents with these large-scale industrial accidents or, acts of terrorism. But the reality is they can happen in everyday settings, too.
Right.
And sometimes the people who are most at risk are the ones who are, maybe unaware of the potential hazards, or they feel pressured to participate in things that, could put them in harm's way.
It really highlights the importance of awareness, Knowledge, not just for the first responders, but for everyone.
Absolutely. The more we know about the chemicals in our environment and the risks that come with them, the better equipped we are to make inform decisions and protect ourselves.
Speaking of knowledge, I think it's time to shift gears a bit and explore that aspect a little further. What do you say?
Let's dive in.
So we were just talking about the importance of knowledge and awareness when it comes to these chemical incidents. Where's a good place to start for, the average person who wants to be more prepared?
Well, I think a good starting point is just understanding the chemicals you might encounter in your everyday life. Take a look around your house. Cleaning products, pesticides, even some pretty common household items, they can all pose a risk if they're not handled properly.
So read those labels, follow the instructions.
Exactly. Know how to store them safely, dispose of them properly. And if you work with chemicals, at your job, make sure you're familiar with all those workplace safety procedures. And of course, make sure you have access to the right protective equipment.
The PPE.
Right, the PPE.
So that's at home, at work. What about like community preparedness? Are there resources out there to help people learn about these chemical hazards and how to respond if there's, an emergency?
Absolutely. A lot of communities have these emergency management agencies or public health departments, and they offer all kinds of information and training programs.
That's great.
Yeah, they can give you guidance on things like evacuation routes, what to do if you need to shelter in place, what to do if there's a chemical release.
So it's worth reaching out to those local resources.
Definitely. And don't forget about, just basic first aid. Knowing how to rotation, all that can make a huge difference, in those first few minutes before professional help arrives.
Those simple steps can really, really make a difference. We've explored the science, the immediate and long-term dangers, the treatments, and of course that critical importance of preparedness. This has been, well, a true deep dive.
It has. It's been fascinating to, really break down this complex topic with you.
And to our listeners, we hope this deep dive equips you to better understand and prepare for these situations should they ever arise. Stay curious, stay informed, and as always, stay safe. Until next time, happy diving.